Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been noticing more issues lately, particularly with my sleep and my ankle pain. The ankle pain seems to flare up now and then, especially after some light activity or at the end of the day. My wife helps me with massages, which soothe it a bit, but it's still bothersome. As for sleep, I've been waking up a lot during the night, and I feel it's starting to affect my daily energy levels.
I understand your concerns. Let's go through each of them systematically. How often does the ankle pain occur, and have you noticed any specific activities that lead to more pain?
It seems to happen a couple of times a week. I notice it more after I've been up and about, walking or doing yard work. I've been using naproxen and liniment massages from my wife, which help temporarily.
Okay, and you mentioned issues with your sleep. Could you describe what happens exactly? How often do you wake up at night?
It's almost every night now. I fall asleep okay, but then I wake up around 2 or 3 a.m. and can't get back to sleep easily. I started taking Advil PM to help, but I'm not sure if it's really solving the problem.
Have you tried any other methods to help with sleep, such as relaxation techniques or adjusting your bedroom environment?
I've tried listening to some calm music and avoiding TV before bed, but it doesn't seem to make much difference.
Let's also talk about your concerns regarding erectile function and testosterone levels. You mentioned this has been a worry for you.
Yes, it's been on my mind. I haven't noticed major symptoms like hair loss or changes in my body, but my sexual drive isn't what it used to be, and it's starting to concern me and my wife.
I see. It's good that you've brought this up. We can certainly look into this further and consider checking your testosterone levels if you haven't done that recently.
We checked it last year and it was on the lower side of normal, but maybe it's time to check again.
Absolutely, we can do that. Now, regarding your diabetes and cholesterol, how have you been managing with your diet and medications?
I've been pretty good with my diet. Cut down a lot on the fried foods and sweets. For my diabetes, I'm on metformin, and for my cholesterol, we're switching from simvastatin to Crestor.
That sounds like a solid plan. Switching to Crestor should help with your cholesterol levels. Now let's look at your most recent lab results to get a better picture of everything.
Yes, please.
Your latest labs show your HbA1c at 7.2, which indicates that your diabetes is reasonably well controlled. Your blood pressure today is 132/78, which is within the target range. Your cholesterol needs some attention, though. Your LDL is at 130, and we're aiming to get that below 100, considering your risk factors.
I understand. Hopefully the Crestor will help with that.
Yes, it should. Your liver and kidney functions are stable, which is great. Your CRP, a marker of inflammation, is slightly elevated at 2.5, which could be linked to some of your physical symptoms like the ankle pain. We should keep an eye on that.
What's the next step then?
Here's the plan. We'll start the Crestor for your cholesterol and monitor how you do with that. I'll order a testosterone level test to address your concerns about your sexual health. We should also consider a sleep study to delve deeper into your sleep issues, as they might be affecting your overall health more than you think.
Sounds like a plan. I appreciate your help, doctor.
Of course, I'll see you back here in 6 months to review everything, but if any issues arise before then, please don't hesitate to contact us. And we'll also keep routine screenings, like your upcoming colonoscopy, on schedule.
Thank you, doctor. I'll follow up with everything and keep you updated.
That's perfect. Take care of yourself and see you soon.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. I see we have quite a few things to discuss today, based on your recent challenges and ongoing conditions. How have you been feeling lately with all these concerns?
Good morning, doctor. Honestly, it's been quite rough. I've been dealing with this shoulder pain that's just not getting any better. You remember I had that injury years ago during my service? Well, they told me back then that I might need a replacement, but I never got around to it. Now I can barely lift my arm. It's like it's locked at this 60-degree angle when I try to raise it, and going forward is even worse, maybe 30 degrees at best.
I understand. That must be very restrictive. How about your other joints, like your elbows and knees?
They're not much better, to be honest. My elbow, for instance, won't straighten all the way, and I hear this grinding sound when I move it. My knees are the same, very stiff and painful. It's affecting my walking now. I've been using a cane just to get around because my hips are also giving me trouble.
That sounds quite debilitating. Have you noticed any patterns or changes in your pain or mobility issues recently?
Well, the pain seems to get worse with any kind of weather change, and the stiffness in the morning is unbearable sometimes. I've had a few falls because I just couldn't stabilize myself. As for my hands and feet, they swell up quite a bit, especially on days when my blood pressure seems to spike.
That's important to note. Let's also touch on your vascular health. You mentioned evaluations for a stent placement.
Yes, I was having some trouble with circulation in my legs, feeling a lot of numbness and cramps. They did some tests and found my ABIs were quite low at one point, but luckily, the last tests showed I didn't need a stent, as the flow is adequate now.
Good to hear the positive news there. You also mentioned some other issues you're facing, like the blister on your foot and problems with nail care.
That's right. There's this persistent blister that just won't heal, and trimming my nails has become an ordeal because I can't bend well. I've been to a podiatrist before, but it's been difficult keeping up with appointments.
I see, and I understand there have been some systemic issues as well, like losing your medical documents.
Yes, that flood really set me back. I lost a lot of my medical records and even some imaging I had done. It's been frustrating trying to get everything sorted out. And honestly, I've had some bad experiences with my current clinic. I'm thinking of transferring somewhere else where I feel more comfortable.
That must be very challenging. Let's see what we can do today to help coordinate your care better and address these multiple health concerns comprehensively. Let's summarize the issues and plan our next steps. First, your shoulder and elbow restrictions are significant. The X-rays we took show advanced osteoarthritis in the shoulder with severe joint space narrowing and osteophyte formation. Your elbow and knees are similarly affected with chronic degenerative changes visible on the imaging. Given these findings and your symptoms, it's clear that we need to manage your arthritis more aggressively.
What does that entail?
We will schedule an MRI to get a detailed view of all affected joints, particularly the shoulder, to assess the feasibility of a replacement. I'll also refer you to an orthopedic specialist who can discuss surgical options for your knee and possibly the elbow if required. For your vascular health, your latest Doppler results are reassuring, but we'll keep monitoring. The ABI of 0.9 is within normal limits, so we'll continue with conservative management there. Regarding your podiatry issues, I'll arrange for a home health nurse to help with wound care and nail management to prevent further complications. Lastly, the elevated CRP and ESR levels indicate active inflammation. We'll start you on a low-dose corticosteroid to help reduce inflammation and an upgraded pain management regimen. Additionally, I'll write the prescriptions for your eye and ear drops today.
And the clinic transfer?
I'll help you with the transfer to a different clinic. I understand the importance of feeling comfortable and respected by your healthcare team. We'll make sure all your medical records are backed up digitally to avoid any future losses. We have a plan now. Let's get started on these actions right away. Do you have any questions or concerns about this plan?
No, that sounds thorough. Thank you for listening and for helping me sort this out.
You're welcome. Let's meet again in 6 weeks to evaluate your progress unless something urgent comes up. Take care.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
I wanted to discuss the complications that arose during your recent surgery. Unfortunately, there was unexpected bleeding that required additional intervention.
I appreciate your honesty, Doctor. Can you tell me what this means for my recovery?
Absolutely. The additional steps we took should mitigate any long-term effects. However, your recovery might be slightly longer than anticipated. We will monitor you closely.
What measures are being taken to prevent this in the future?
We're conducting a full review of the surgery to understand the cause of the bleeding and to refine our procedures. Ensuring this doesn't happen again is a priority for us.
How will this affect my daily life in the coming weeks?
You'll need to avoid strenuous activities and might experience more fatigue. We'll schedule regular checkups to manage any pain or complications efficiently.
Now look at question 26.
Today, we'll explore the impact of substance abuse on individuals and communities. Substance abuse isn't just about illegal drugs. It also covers prescription drug abuse and excessive alcohol consumption. The effects are far-reaching, impacting physical health, mental health, and even social stability. Our focus is on understanding these impacts and discussing strategies for prevention and treatment. We'll also look at the role of healthcare professionals in addressing this issue. Let's discuss the signs of substance abuse, which often include changes in behavior, deteriorating physical appearance, and withdrawal from social activities. It's crucial to recognize these signs early to provide support and intervention. Next, we'll examine case studies to illustrate effective treatment strategies.
Now look at question 27.
Before we proceed with the treatment plan, I need to go over the consent form with you. It outlines the benefits and risks associated with the procedure. Do you feel comfortable with this information?
Could you explain a bit more about the risks?
Of course, the primary risks include infection, reaction to anesthesia, and in rare cases, complications that could require further intervention. Our team is highly skilled and will take every precaution to minimize these risks.
That clarifies things. I'm ready to sign the consent form now.
Great. I'll walk you through the paperwork. It's important that you understand every part of the form as it ensures your informed decision-making.
Now look at question 28.
Good afternoon, everyone. Today's session is dedicated to enhancing our performance as nursing professionals. Our aim is to foster a culture of continuous improvement through advanced training programs, mentorship opportunities, and regular feedback cycles. By investing in these areas, we can improve patient care, increase job satisfaction, and reduce burnout. We'll also discuss how implementing new technology can assist us in our daily tasks and make our workflow more efficient. I'll be showing you some success stories from other institutions where similar programs have led to significant improvements in clinical outcomes. We'll also have breakout sessions to brainstorm how we can tailor these strategies to our specific needs.
Now look at question 29.
I understand that medical bills can be overwhelming, so I want to discuss some financial assistance programs that might help. Many hospitals, including ours, offer sliding scale fees based on income.
That's a relief to hear. How do I apply for these programs?
Our counseling department can guide you through the process. They'll need some information about your income and expenses to determine your eligibility.
Thank you, doctor. I'll visit them right after our appointment.
I'll make sure they expect you. It's important that we alleviate your stress so you can focus on recovery without financial burden.
Now look at question 30.
Today, we're here to talk about gender-affirming surgery, an important aspect of transgender healthcare. These surgical procedures, which include top surgery, bottom surgery, and facial feminization surgery, are designed to align individuals' physical appearance with their gender identity. We'll discuss the surgical options available, the preparation process, expected outcomes, and post-operative care. It's crucial for healthcare providers to support patients throughout their journey, ensuring a respectful and empathetic approach. Additionally, I'll provide detailed information about each procedure, discuss eligibility criteria, and explain how these surgeries can significantly improve quality of life. We'll conclude with a Q&A session to address any questions or concerns you might have.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Good day, everyone. Welcome to our in-depth discussion on the impact of clinical trial design on patient outcomes, focusing particularly on the interpretation of secondary outcomes and their significance in clinical practice. Today, we'll explore this complex topic through a case study derived from a series of studies referenced in scholarly articles from Harvard's database. To set the stage, let's consider the hypothetical case of Mr. Johnson, a 65-year-old male with peripheral artery disease, PAD, who recently underwent revascularization. Mr. Johnson's case is particularly pertinent, as it mirrors scenarios often seen in clinical trials, where multiple outcomes are measured to assess the efficacy of interventions like the anticoagulant, rivaroxaban. In the trial of rivaroxaban, the primary outcome was a composite of acute limb ischemia, major amputation for vascular causes, myocardial infarction, ischemic stroke, or death from cardiovascular causes. This mirrors the serious complications Mr. Johnson aims to avoid post-surgery. Secondary outcomes included hospitalizations for thrombotic events and other variations of the primary composite outcome. Let's delve into the significance of these outcomes. When interpreting secondary outcomes, one must be cautious. Although they provide valuable insights into the nuanced effects of a treatment beyond the primary endpoints, they can also introduce biases if not properly controlled for statistical significance. This can lead to what we call a multiplicity problem, where the more outcomes tested, the higher the chance of a false positive. This brings us to the concept of hierarchical testing used in the rivaroxaban study. Hierarchical testing means that secondary outcomes are prioritized and tested in sequence based on their importance and the success of the primary outcome. This approach controls the family-wise error rate, essentially keeping the probability of making one or more type 1 errors among all hypotheses within acceptable bounds. Now, relating this back to Mr. Johnson's care, consider if he were part of such a trial. The information gleaned from both primary and secondary outcomes directly influences clinical decisions post-trial. For instance, the trial's findings showed that while rivaroxaban effectively reduced the rate of the primary composite outcome, it also increased the risk of major bleeding, a secondary safety outcome. This illustrates an essential point about the role of secondary outcomes in guiding treatment decisions. Usually, they are not the basis for regulatory approval, but they are crucial for understanding the broader implications of a treatment. For Mr. Johnson, knowing the potential for major bleeding would be critical in weighing the benefits and risks of continuing rivaroxaban versus other less risky alternatives. Another layer to consider is the pre-specification of these outcomes in the study's protocol. This ensures that the findings are the result of evidence planned and collected according to a predetermined methodology, rather than adjusted post hoc to fit the observed results. It's a safeguard against bias, ensuring that the trial results are both reliable and replicable. While primary outcomes tell us whether a treatment achieves its most crucial objective, secondary outcomes like those observed in the rivaroxaban trial provide a fuller picture of a treatment's benefits and drawbacks. For clinicians treating patients like Mr. Johnson, these details are indispensable. They guide more personalized treatment plans and inform risk-benefit discussions with patients. Thank you for joining today's session. I hope this discussion enlightens your understanding of the critical role of secondary outcomes in clinical trials and helps you appreciate the complexity of applying these findings in real-world clinical settings.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Welcome. I'm Dr. Lisa Harmon, and as a specialist in pain management, my goal is to balance effective pain control with the safety concerns surrounding opioid use. Today, we aim to explore the nuanced perspectives of both clinicians and patients to improve our understanding and approaches to pain management. Joining me today is Mark, a patient who has been navigating the challenges of chronic pain management for over a decade.
Hello everyone, I'm Mark, and I've been living with chronic back pain since an accident in 2008. Throughout this time, I've tried various treatments and medications, including opioids. While they've been crucial in managing my pain, navigating the changes in opioid prescribing guidelines has been a continuous challenge.
Thank you for sharing your story, Mark. It's critical to consider both the benefits and risks of opioids to ensure our patients can lead functional lives without unnecessary complications.
It's great to be here, Dr. Harmon. I appreciate the opportunity to discuss these issues. Initially, opioids helped me regain much of my lost mobility and quality of life. However, as regulations have tightened, I've faced numerous hurdles in accessing the same level of care that I once did.
Mark's experience highlights a common dilemma in the medical community. There's an ever-present tension between adequately treating pain and avoiding the overprescription of opioids. Research from Harvard suggests that personalized care plans, which integrate both pharmacological and non-pharmacological therapies, are more effective in managing chronic pain. This holistic approach not only addresses the physical aspects of pain, but also the psychological ones.
That holistic approach sounds ideal, Dr. Harmon. But when my longtime physician retired, his replacement was reluctant to continue my established opioid regimen. This change was not based on my health status, but seemed more about the doctor's concern over regulatory scrutiny.
Such transitions can disrupt patient care significantly. The fear among healthcare providers about regulatory consequences, even when following clinical guidelines, can deter them from prescribing opioids, even when they are the best option for the patient. Integrating decision support tools within our electronic health systems could help clinicians make more informed, confident decisions about opioid prescribing.
Absolutely. And during one of these transitions, I had a pharmacist refuse to fill my prescription due to their concerns over the prescribed dosage, which had been stable for years. It felt like a judgment of my needs and character, not a professional assessment.
Pharmacists are indeed in a tough position, as they too are held accountable for ensuring safe medication use. However, this system sometimes fails to distinguish between patients with legitimate medical needs and potential misuse. Enhancing communication between pharmacists and prescribers could help bridge this gap, ensuring that patients like yourself aren't caught in the crossfire.
Improved communication would make a huge difference. I often feel like I'm just a bystander in my own care, caught between different members of my healthcare team who are not on the same page.
That's why promoting an interdisciplinary approach is crucial. Teams comprising physicians, pharmacists, physical therapists, and mental health professionals can provide more comprehensive care. Research supports this collaborative approach, showing significant improvements in patient outcomes.
I've seen firsthand how effective comprehensive care can be. When my treatment team works together, I feel more supported and secure, which actually helps me manage my pain better.
Exactly, Mark. The mental and emotional impacts of chronic pain are profound. Feeling understood and supported by your healthcare providers can significantly affect your pain perception and overall well-being. Ongoing studies highlight the importance of incorporating mental health support into chronic pain management programs.
It's encouraging to hear about these developments. It gives me hope that the approach to pain management will continue to evolve in a way that supports those of us dealing with chronic pain daily.
Your insights today have been invaluable, Mark. It's essential for healthcare providers to listen to their patients and learn from them. Only through open dialogue and continued research can we find the right balance in managing chronic pain effectively while mitigating the risks associated with opioids. Our discussion today underscores the complexity of pain management in the context of the opioid epidemic. By enhancing communication, advocating for team-based care, and integrating research-driven strategies, we can better serve patients like Mark while addressing broader public health challenges. Thank you for joining us.